morning. My name is Jill Geisinger, and I'm the administrator with Carbon County Children and Youth. And this is the 26-27 needs-based budget, public budget meeting. I'm presenting a slideshow today to talk about what we are requesting in our needs-based budget for the next fiscal year. And we'll proceed with the slideshow. So our agency mission is children and youth services, prevent child abuse and neglect, provide services to children and families, promote safety and well-being of children with disabilities. And we'll continue to do that. And this the needs-based plan and budget process is used to determine the service level of need in each county and develop funding allocations to ensure that the needs of children and families being served are met. This is in Act 30 of 1991 and created the current process for our funding and our budget process. So every year we do present the budget to the public and requesting what we need for our families based on past needs and needed. So these are our reports that come. Children and Youth is mandated to investigate abuse and neglect that happens in Carbon County. And this will show from 2022, 2 years post-COVID, 23, 24, and these reports, as you'll see at the top, GPS, General Protective Services and Child Protective Services, which are more serious abuse cases, such as broken bones, sexual abuse, and neglect. Here you'll see the change for these reports. We've seen quite a rise in the new reports, 13%, February, March, 24%. And our averages, sorry, we're a bit of audio. Thank you. All good? Okay, thank you. You'll see the average number of reports on the very right-hand side. Again, these reports come in as from our mandated reporters or concerned citizens. They call them into Childline, and it is our mandate to investigate these. Our 14 staff right now each take a few cases and investigate and assess whether the children are safe and abuse has occurred. These are the allegations by type. So we saw how many reports were coming in by the month. And this per fiscal year, which runs from July 1st to June 30th, you'll see the number of reports. Now, the reports are a little bit different because the categories, there was quite a few categories that were just a few reports, and they're at the bottom there. So it did skew the numbers a little bit. But you'll see our highest number of reports that we investigate on pretty much a daily basis is the conduct by parent that puts children at risk. And these are the cases that we're out on. These are the complex matters that we're trying to help families with. A lot of behavioral health concerns and a little bit of increase in homelessness and inadequate shelters, which we try to address through our budget needs. And of course, substance abuse continues to be a high number of reports. So leading into that, these are our budget requests, our new requests for our needs-based budget, which will start July 1st of 2026. Some of these requests have come from our staff, and some of this has come from the data that you've seen. So we would like to lease a 5th vehicle. We have 4 vehicles right now that are constantly out on the road, helping caseworkers meet the needs of their families. So either providing visitation for parents who need to complete goals to get their children returned to them, to go out and see families, and of course to drive to placement agencies to see children who need to have that higher level of care. We do not have any facilities in Carbon County. That's why we need to provide transportation vehicles to our staff so that they can go safely to those visitations. So a lease would cost us about $10,000 a year. We do have a lot of vacancies, and I do have a chart later on in the slides that I can show you where our vacancies are right now. but we do have 11 vacancies that we would like to fill with qualified staff. So we have to account for that, and that's 250,000. Again, these numbers are rounded to kind of make it easier to discuss. The next thing is building costs and fixes. So we did ask the state to help us to make sure our building is up to code, fixing roof or adding onto the building where we need, providing a space for our security guard. And it was approved in last year's budget, so we're adding it again to this year's budget, and we can put in about $50,000 for those repairs. Next is staff. I didn't ask for any new staff in this budget, as we seem to be okay right now. The one thing that we really feel that we need to add to our staff is a licensed social worker. So we've been inundated, which is wonderful, with interns, people who want to work in the field, continue to help families. And we have no licensed person on staff to help build someone with a master's degree. So if we added, we changed one position, one caseworker two position to a social worker position, which is allowable by civil service, it would cost approximately $6,600 to increase that salary just to be able to have that licensed person on staff. Of course, they would make a little more money than a normal caseworker too, because they would have that added licensure. The other staff that we have in our building is a security guard who protects us. We did ask, put in the budget to try to have an armed security guard. We had a couple incidents this year, and again, because we moved out of the Jim Thorpe area, we don't have a deputy assigned to our building. If we did add this service, it would cost about $21,000, and that would just be basically to cover benefits that we're not providing right now with part-time security. Next is our St. Luke's Family Development Specialist, which has been doing wonders for us. They're asking for a 3% increase in the cost of that service, and we have a worker in Panther Valley School District who really helps point families to resources that they need. It's been doing a great service to us. We've seen a 2% decrease in reports from Panther Valley area because it is a deterrent and a diversionary service with that worker there in the school. So I'd like to put in for that increase to support that. Next is also a request from our staff is Life 360 app. So they all have county issued cell phones, and having that app to let us know where they are in case there was an emergency, that app would provide that service to them, that added safety and security, and able to provide a response if necessary. And at a daily rate with the 27 staff, it would equal out to about $5,000. Okay, programming. So we do consult out our fiscal department, and that consulting would be about $3,000 increase for that service as we go into our second year of consulting with them. We want to continue that. Our provider rate increases. Unfortunately, due to insurance increases and staff issues, everything that providers are facing, we do have 80 children in care right now. So we have to account for any kind of increases that the providers are asking through our contracted rates. And if we continue to keep those children in placements and anticipating new children coming in that need that higher level of care, it equaled out to about $800,000 increase, unfortunately, in this next budget. So we're trying to anticipate that and ask for that reimbursement here with those increases. Day treatment. This is a request through Children, Youth, and our juvenile probation office. Day treatment is a service for teens who are experiencing truancy, who maybe make some poor choices, maybe have summary offenses, maybe need a little extra homework help, mentoring. So day treatment was offered through a program in Lehighton that had to close. And we found another service, Diacon, who is willing to work with us to create the day treatment program. They have a functioning day treatment program in another county that they could model this after. So if the state would agree to provide us the startup costs and the per diem rate for the children, it would cost about $350,000. And we would be able to have that program for those teens and hopefully have them not come into our placement, come into JPO placement. And this is also a service that we've had in the past that's been in the budget that got taken out because we didn't have a provider. So we did provide this before, and it's a program for children in the home. So they would be helping the families to build a strength so that they don't get referred to either office. Great program and great deterrent program for families, and they work with the schools to help truancy numbers decline. New adoptions would simply be federal funds that we would be asking for, completely federal funds for kids who are finding a permanent placement. So we anticipate now that we have secured a solicitor and are able to go through with adoptions much easier, that will cost about $100,000, but it is federal money. Juvenile probation has asked for an incentive program providing gift cards to kids that really do great work when they're working with their probation officer, and we want to continue that program. A SmartLink app that is a daily app on their phone that checks in with them, kind of reminds them, hey, continue to do a good job, and check in with us so that we know where they are, and hopefully they're making good choices. It's a really great service, and it's a daily fee. About $2,000. A restitution fund, which would allow children on probation to make a little bit money back to pay for whatever damages that they may have caused when they committed whatever they're there for probation for, and having that money set aside for them. And it's also teaching them skills for the future. So great program. Hopefully we can get this program we asked for last year, and that's about $5,000. And then of course the school justice panel is a promising practice program offered through Impact, also through the grants funding. So it's not any new funding because we did put in for it, and asked for that program for our second year. So with all that added up, the total new adds up to be about $1.5 million, and the county's cost would be 20% of that, which would be $370,000 new spending for fiscal year 26-27. Grants are awarded to us every year. There's specific grants that we get, evidence-based services and IT equipment. So part of the grant is to update old equipment. We have 12 laptops that are over 5 years old that we'd like to replace. We're put that in for the grants for the new fiscal year. A new office printer. We've had a printer, it's probably 15 years old, kind of taken the dive. So asking to replace that printer so we can meet our county business. Evidence-based programs. Very important to have these services for our families. Again, trying to keep families together in the home and avoid placements. Some of the new programs that have been offered are Healthy Families America, which is offered through Justice Works, and we asked for some funding for that to support 5 families that we currently have. Multisystemic therapy is for teens working in the home with families. Some of this is covered through insurance, some of it is not, so we wanted to ask for grants in order to cover this service for the families that don't have the insurance or don't qualify through the insurance. And family functional therapy. This is a very in-depth service. It's 30 sessions with a family, with a licensed professional that comes in and really dives deep into dysfunction and behavioral health and mental health issues in a family. It's extremely expensive. We did ask for it last year, but we didn't have a contract with any services. So we do have talks with a contracted service that is able to provide this for us. So we did ask for the family functional therapy. And then parents as teachers. I was informed by the Right from the Start director that their grant has expired. We can cover that through our grant, which is funded 80% through the state and 20% through the county to cover the whole program. So we asked in this year's budget for 2 more staff, so they would have 4 staff because there was a huge waiting list. We had, in 2020, we had 5 child deaths, and we really felt that parents as teachers and right from the start would be an answer. So we started referring every child under the age of 5 to the program so that they would get some in-home support and also to build on reading skills and parenting skills through this program. So we did increase our costs for this calendar year. And we're also asking to expand to cover that grant money that they're losing in the next fiscal year so we can keep the program afloat, keep it working, and keep helping families in need. Here's the organizational chart as it stands, with changing 1 caseworker 2 to a social worker 1, continuing to have 4 units with caseworkers in them, and another clerical unit with a program specialist and so there isn't really any change to the chart. It would just be, again, changing 1 position in the chart and then existing staff with filling vacancies. Purple is contracted services outside of the county. Green is vacant. And I see there's a piece that should be. Lastly, I just wanted to share some data trends that we had and we saw and we put into this budget to show how we are doing. Okay, the first one is adoption assistance, which I'm very proud of. We don't want to have children lingering in care. We want to provide them permanency in a loving home to be in forever. And you'll see that the first chart is the first chart on the left is our adoption numbers, and they have gone up. The next chart to the right is our permanent legal custodians. So if the child does not want to be adopted because maybe they're a teenager or they're living with their grandmother or some other relative, or they choose not to be adopted, we can give them permanent legal custodianship. And you'll see that that number has also increased. So children are getting into permanent homes in Carbon County, which is great to see. The bottom left-hand chart is our residential services. This is one to just, again, to show that not having foster homes in Carbon County does have an impact on children. And unfortunately, if we can't find a foster home that can meet their needs or a family member that can meet their needs, we have to put them in a higher level of care. So you'll see our residential numbers have gone up. We were hovering last year from 3 to 5 children in a dependent residential service, and now we're up to 12. So we obviously want to bring that down, just again to show the need to account for having children in that higher level of care and why that number is so high for provider rates. And then the last chart on the bottom is delinquent residential services. Again, to show that we have to account for our JPO kids needing to be placed. There's really no detention beds available, but we are finding some residential beds, and we have to account for that increase in cost when they weren't using those beds previously, but it is now needed in our budget as well. So what we're looking at for our total budget for 26-27, $11,997,306 with all the additional costs and the new requests. We'll be presenting that to the commissioners and to the state for feedback. Any questions?